Hi, I'm Nancy Brown, Chief Executive Officer of the American Heart Association. This Heart Month, I am so delighted to be joined by Representative Joyce Beatty, co-chair of the Congressional Heart Caucus, chair of the Congressional Black Caucus, a dear friend, and former member of the American Heart Association. Joyce, it's so good to be with you today.
Thank you. It's truly my honor to be here, and I'm always excited when we can impart some knowledge and some education on this topic.
Absolutely. And as you know, Joyce, very well, cardiovascular disease is the number one killer of women. It claims the lives of 1 in 3 women every single year. What makes Heart Month so important to you?
Well, Heart Month is so important to me when I reflect on it from a personal standpoint. My mother had heart conditions. My grandmother died of a heart attack, and I'm a stroke survivor. So it's very important to me that I have the opportunity to do chats like we're doing. I think it's so important to women. You just gave us the statistics that it's the number one killer for female. So it's important that we educate. It's important for me as many times as I can, Nancy, to tell women to listen to your body. And so I enjoy this, whether it's this or whether it's Go Red for Women, whether it's the Circle of Red, or it's actually watching you work magic in a boardroom. I'm all in because it's very personal to me. And I think that's the best way to convey our stories to the public. You all do that so well with the Heart Association. You bring people in who are very diverse, young people, married people, single people, professional people. And that tells the story that it can happen to any of us.
It's so true, Joyce. You know, I'm reflecting on how every year for so many years you have graciously convened the passionate and powerful women of Congress when we were able to be face to face for our annual Go Red congressional photo. And thank you so much for doing that. And I know during the course of those photos, I've had a chance to talk to some of your colleagues in Congress. And one of the things that people don't know, that in addition to cardiovascular disease being the number one killer of women, it's also the number one killer of new moms. And I recall having this discussion with one of your colleagues a couple of years ago, and it strikes me that we need to continue to raise awareness of this and to reduce health disparities in pregnant and postpartum individuals. What do you think about that? What ideas do you have, or what reflections do you have on that?
Well, it's interesting that you mentioned that. I belong to the Heart Caucus. And when we talk about maternal deaths, I think it's important because most people don't know that 1 in 3 pregnancy-related deaths occur. And for brown and Black women, it's 4 to 5 times higher than their counterparts. There's so many disparities, and I think people don't know it. You know, so often when we talk about the number one killer, there was just a survey we did with women in organizations, and many people thought it was cancer or one of the cancers. So when we started talking about the relationship between cardiovascular disease and the relationship between stroke, and then when we talk about maternal death and how that's related to cardiovascular, it only tells me that we have to get more information. And I think it's education and awareness. And so often it seems so complicated. So I go back again to having physicians come on and tell their own stories or the stories of their patients. And I think it starts, or should start, at the very beginning of your pregnancy, when you start thinking about being pregnant. And there are no questions that are off limits. People are so afraid to ask, what should I be doing for healthcare? Should I look at my family background? When you look at what might be hereditary or through genetics. So I think all of those things we have to discuss.
Yeah, such important points. And I'm really glad you brought up the issue of health disparities. And first of all, before I ask you a question on health disparities, I want to tell you how proud I am of you and how excited we are that you've been named the chairwoman of the Congressional Black Caucus. That is so exciting. And as we commemorate Black History Month, I'm very interested in your perspective on how we as a nation can address health disparities and improve health in all communities. Clearly, this has become so much in the spotlight with the COVID-19 pandemic. It's something we've known at the AHA for a long time, and we've been working to address these issues for a long time. You now have a unique vantage point and an opportunity to influence this work. We'd love your thoughts on it.
Well, let me just say thank you so much for that. It is an honor that I have been elected by my peers in Congress to be the chair of the Congressional Black Caucus. And by the way, this is our 50th anniversary, and it is our historic number of members. We have the largest caucus in the Congress. You won't be surprised by this, but as a matter of fact, not one of my number one priority is, of course, healthcare. And so when we talk about COVID-19, when we talk about cardiovascular and stroke disease and diabetes, that's all up front. Because when we mention disparities, Black Americans make up 13% of the national population. And when you look at COVID-19, for example, we're in the numbers of 18 or 20% with the death rates. When we look at cardiovascular disease, we're 30% higher than our non-Hispanic and white Americans. So we know that we are affected disproportionately. We also know that research and statistics indicate that we have to look at the correlation between Black Americans who are diabetic, obesity. We also know oftentimes when you look at poverty, we are in greater numbers because of all of those critical factors. And certainly I have to say, and the cultural and systemic racism that is there. All of that right now is why in government and in your work, we're looking at disparities. You have an amazing research arm that you pay a lot of attention to. And I think it's so important for people to know that there is not a face that can't be affected by this. So this is a bipartisan effort. We have women of all races and ethnicity, political parties. Everyone gets excited about making a difference and fighting against cardiovascular disease. And I don't think you can get any better research or factors or individuals then you can come and say, Congress is doing something right. We are fighting against cardiovascular disease.
Absolutely. And we're so grateful for all the support. When we speak about health disparities, here's a statistic for you that you'll be interested in knowing, Joyce. We, of course, have long championed high quality, affordable, accessible healthcare for all Americans. It's a value we share, you and I share personally, and it's certainly a core pillar of the work of the AHA. We released a study that was presented at a scientific meeting we had about hypertension back in September that showed that the percentage of people who have their blood pressure under control is declining. But for individuals who have not seen a healthcare provider in the last 12 months, they have an 8% control rate. So that is unacceptable. And it just speaks to the importance of access to healthcare, fighting disparities, addressing the social determinants of health, all the things that you have articulated so beautifully, all the things that are an important part of your platform as chairwoman of the Congressional Black Caucus and as a longtime friend and advocate of the American Heart Association. Congresswoman Joyce Beatty, thank you for your time today. Happy Heart Month.
Thank you.
Yeah, there we go. Perfect. Hi, I'm Nancy Brown, CEO of the American Heart Association. This Heart Month, I'm thrilled to be joined by Representative Chris Smith of New Jersey, who serves as co-chair of the Congressional Heart Caucus. Thank you so much for joining today, Representative Smith.
Nancy, thank you so much for inviting. I appreciate it. And thank you for your extraordinarily good work.
Well, thank you so much. And we are so grateful for the leadership of the Congressional Heart Caucus. And one of the things that I wanted to ask you about is tell us a little about why Heart Month is important to you.
Well, I've been in Congress now 41 years. I've known many members of Congress who have suffered heart or cardiovascular problems. Many in my family, including my grandfather, who died of a heart attack. My wife has members of her family who have died from heart attacks and strokes. So it's something that malaffects every one of us. And there's so much more we can be doing. Some of it is very simple in terms of lifestyle, making sure that we eat right, exercise, get good nutrition, the right kind of vitamins and the like. This is preventable to a large extent. Yes, some heart problems will manifest, some are hereditary, but much of it is preventable. And that not only from the standpoint of losing your life, but also disability that follows after a stroke or some of these other terrible manifestations of heart disease. So it's a winnable war, and we need to be willing to give it everything we have. There's a lot of money, as you know, that NIH, and we continually up that pot of money for the NIH, the CDC, and a number of very specific programs, especially targeted to women who are disproportionately malaffected, again, by heart disease.
Yeah, such an important point. And I know that along with Representative Joyce Beatty, you're co-chair of the Congressional Heart Caucus, you and the caucus have a laser focus on addressing these issues. And we're so grateful to you for that, especially during a global pandemic. We know that cardiovascular disease remains the leading cause of death in the United States, and experts predict the burden will grow as we see the long-term effects of COVID-19, which we know can damage a patient's heart, brain, vascular system, and other vital organs. Tell us a little about how Congress is supporting research on the coronavirus and how it attacks the body and the life-threatening complications.
Well, in the last appropriations bill, the fiscal year 2021, we had specific language that focuses on the impacts that intermediate long-term effects of COVID-19 has on the heart and other vital organs. Because we know it's there. There's more than just anecdotal suggestions of it. And since the virus is only, a little over a year old, we're still learning. But that's where we need the scholarship of the NIH deploying its critical funding to make sure that people who now are hurt because of that, because they had COVID-19, for example, but now they also have concurrent problems that are heart related.
The other thing about the global pandemic is that many Americans, as they have been sheltering in place or staying at home, have developed unhealthy eating habits and sedentary lifestyle, and actually, maybe even have some issues of anxiety or mental health concerns. And of course, at the American Heart Association, we worry about all of these things because they can increase the risk of heart disease and stroke. How can Congress help prevent cardiovascular disease by emphasizing proper nutrition, physical activity, and other healthy behaviors?
It's a great question, Nancy. One is to accelerate our visibility, to focus on making sure you get that exercise 30 minutes a day or whatever it is that works for you. I'm encouraged, though, I see in my neighborhood, a lot of people are walking. They're out there, husband and wives, children, they're all out there walking. And the more we encourage that, the better. And that doesn't take legislation. That just takes a lot of common sense and a big push. And you guys have done a great job of emphasizing that. So exercise is critical. Again, as we do the funding, because we're the funders of these important projects, to make sure that NIH keeps its eye on that ball. A lot of people have not gone into the hospital who need, or even to see their doctor, who might need some preventive work or to catch early the manifestation of heart disease. And so there's a backlog there. In the early days, COVID was exclusive at our hospitals, and all of those types of interventions became, forgotten, not really forgotten, but just not scheduled. So there needs to be, I think, a re-emphasis on, those visits to make sure that the blood pressure and everything else is being properly monitored, because all of the, again, cardiovascular disease is largely preventable but it does take a plan, and everyone has to have their own plan, especially as they grow older.
Yeah, so such important points. And as a matter of fact, the lack of access of emergency medical care during the beginning of the pandemic is exactly why at the American Heart Association, we created a campaign called Don't Die of Doubt to remind people of the urgent need to access emergency care if they were having the warning signs of a heart attack or of a stroke, and how important it is always to listen to our own bodies. We're so grateful to you, Congressman Smith, and to Representative Beatty for leading the Congressional Heart Caucus, for keeping these issues at the top of minds of our elected officials. Thank you for your leadership. Happy Heart Month. And we'll check in with you again real soon.